I'm Kelli Stovall, Vice President of Pharmacy Services and Clinical Programs at IPC. And today I'm here with Ashley Judd. She's our Remote Patient Monitoring Administrator. Ashley, so glad to have you here. Wanted to take a moment really to get to know you a little bit better. One of the things I was most impressed when we first met was your passion for remote patient monitoring. I'd love for you to take a second to share where that comes from.
Of course, and so happy to be here. So a little bit about me. I've been doing remote patient monitoring for about 5 to 6 years. And what got me into remote patient monitoring was my grandmother. I am from Chicago, which, as you all probably know, is a rural urban area. My grandma lived in rural Kentucky. So I got a phone call that she was diagnosed with stage 4 lung cancer and she could not travel due to needing treatment. So I packed up me and my family and we went there to support her. Now, in the event of that, of course, I had to work. The nearest hospital that I was working at was in Lexington, Kentucky, and that was about 2 hours from my grandma. The nearest hospital, which was not a specialty hospital, was about 30 minutes away from my grandma, and her cancer center was about 2 hours away. So my grandma was suffering. She was going through a lot, low blood pressures, low stats on her pulse ox. And at that time, remote patient monitoring wasn't very big. So I would be 2 hours away from my grandmother and I would be at work and I would get calls that she needed emergency services because she started to decline rapidly. So when I had to leave to get to her, it took me about 2 hours, of course. But then also the patients on the unit that I was working was suffering because I was constantly leaving work. So not only was not having access to care impacting my grandmother because she had an illness, it was also impacting me and my family. So what I do believe and what got me so interested in remote patient monitoring was that back then, if we would have had digital health, and she would have had a blood pressure cuff or a pulse oximeter, we would be able to get those vitals immediately and been able to interact quickly versus having to wait those hours for somebody to get to her. And I'm not going to say that it would have saved her life, but I do think it would have helped prolong her life if we would have had that access.
Certainly could have improved her quality of life too. I'm sure it affected the entire family in that regard. That is such a good example. And thank you so much for sharing that. That is such a good example of how remote patient monitoring can affect rural health and really bring care to patients that have difficulty finding it in their areas. Um, so when you think about community pharmacies and bringing remote patient monitoring into community pharmacies, how do you see that fit?
I see it fit because I was introduced to rural Kentucky. Um, the independents are the staples. So if my grandma had an issue and her doctor was seeing almost the whole entire county, and it sounds absurd, but it's the truth, she would reach out to her pharmacist and she'd say, "Hey, I need help. Can you call my doctor?" Or something doesn't feel right, or something doesn't look right with my vitals. So, and then of course that pharmacist was also filling her prescription. So they had that relationship. So as of right now, as independent pharmacists, you are staples in your community. You already have trusting relationships with these patients and sometimes with the providers. And I think for you to be able to provide that clinical service, that digital health, that remote patient monitoring to your patients, it'll stop hospitalizations, same day sick visits, or those urgent care visits that can be intervened with the preventative medicine.
That's great. I agree that it can have a powerful impact on community health. Um, thank you for taking this few minutes to talk with me today about
Of course.
this. To those listening, if you're interested in learning more about remote patient monitoring and our RPM platform, iCare Plus RPM, reach out to myself or Ashley, and we're happy to help you.
Thank you.
Thank you.